Hi, Sparky here. I'm a registered dental hygienist and I wanted to make a video today in regards to gum disease. Bacteria is like poison to your gums. So if bacteria is hanging out along your gum line, it's going to cause redness, swelling, bleeding, and pain. All of these are symptoms of gingivitis. Gingivitis is an infection in your gums. You'll know you have it because you'll experience one of those symptoms or all of those symptoms. It may bleed when you brush or floss generally throughout your mouth or just locally in one section. It's an easy fix to cure, totally reversible. You just keep the area clean by brushing and flossing and it will heal. Healthy gums don't bleed. So let's say you leave gingivitis in your mouth. Well, it will become progressively worse and eventually the body will try and move away from the bacteria. So it will start dropping the bone and gums down the tooth. At that stage, it's called periodontitis, and that is not reversible. So what's so bad about having periodontitis? Well, several things. So some things that can occur during periodontitis are recession. So recession is where the roots are now exposed. The top part of your tooth is made out of enamel. The lower part of your tooth is made out of cementum. The lower part is the root. You'll be able to view it because it's more yellowy color than the top part of your tooth. Cementum is softer, so it's easier to decay and easier to feel sensitivity. Therefore, you don't want your roots exposed. Another thing is when the bone drops, the teeth may not be as supported in the jaw and may. Another thing, in health, our gums come to a nice pink point interdentally, so in between our teeth. When we have perio, the gums become blunted and flat. Therefore, there's an empty space in between our teeth. In that empty space, food can get caught. Bacteria will conjugate to eat that food. We may experience a cavity. We may experience more bone loss. Another thing that occurs is deep pocketing around our teeth. Very difficult to clean those deep pockets at home. And the bacteria that grows down in those deep pockets is toxic. It does not require air to live and has a bad odor. So sadly, you can often smell these people when they come into the room. So how soon does the bone and gums drop down the teeth? Well, that varies from person to person. If you have an immunosuppressant condition such as diabetes, HIV, Crohn's, lupus, arthritis, etc., then periodontitis will advance at a quicker rate just because the body is already tired from battling another condition chronically. So how do you know if you have periodontitis? Well, they can let you know at the dentist's office. They have a probe. It has 1 millimeter increments on it, and they put that next to the tooth and they can see if there's been bone loss. 1 to 3 millimeters means health. Anything beyond that means there's been bone loss. Another thing they can use is radiographs. Radiograph shows a photo of bone and tooth, just hard tissue. So we'll be able to see if the bone loss has occurred, but we will not be able to see to scale, meaning how many millimeters of bone loss. So what do you do if you have periodontitis? If you have periodontitis, you should be attending the dental office for cleanings every 3 to 4 months. They'll be using an ultrasonic tool to clean your teeth, which is an instrument that sprays water and vibrates while it cleans. You'll be getting a deep cleaning, meaning that we'll be cleaning as deep down into those pockets as we can reach. Sometimes local anesthetic is required for pain management. At home, a person with periodontitis should be brushing at least twice a day, one for sure in the evening before bed, and cleaning interdentally at least once a day, one definitely before bed as well. You want your mouth as perfectly clean at night because that's when bacteria does the most damage. Interdental cleaning can be floss, water pick, Proxibrush. Water picks are great because they can flush deep down into the pocket. If you have any questions, you can leave a question below. I will also be posting other videos in regards to oral health. Thank you so much for watching and have a great day. Bye.